In the name of God. Hello students. Our topic today is circulatory system. Here you observe one structural model of the wall of vessels here. I told you that we have one structural model that represents all vessels and simplified in the small vessels such as capillaries. The innermost layer, that is also the thinnest one, we call it tunica intima, that is composed of one endothelium, that is simple squamous layer supported by lamina propria or loose connective tissue. Here we call it subendothelial layer. And the middle layer is tunica media, that is the thickest one in the arteries. In the all vessels, we have stroma of collagen type 3 or reticular fibers in the media, collagen type 3. And on these reticular fibers, we have muscles, smooth muscles and elastic fibers. Listen to me, please. The amount of smooth muscle and elastic fibers in the media related to the distance of vessels from heart. If the vessel is near to heart, such as aorta, we have more elastic fibers, and we call these artery elastic artery. And if it is far and is distributing artery or muscular artery, we have more smooth muscles. And external layer, outermost layer, is tunica adventitia, that is thickest one in the veins. And we have stroma of collagen type 1 or bundles of collagen here. And also in the large vessels such as aorta, such as large veins, we have vasa vasarum, the vessels that nourish the wall of the vessel also. Here you observe one picture of medium-sized artery, and in the medium-sized artery, internal elastic layer is one elastic layer, elastic lamina that separates intima, thin intima from media, and also we have thinner external elastic layer that separates media from adventitia in the medium-sized artery. So in medium-sized artery, we can distinguish between the layers very good, but in the other vessels, this layer are not distinguishable, obviously. And compared with the wall of the artery at the up and the vein at the down, that in comparing with the artery and vein with same size, the wall of artery is thicker than vein. And also, I told you before that the lumen of the veins usually is irregular and in the artery is regular. And also, in many times we have blood inside veins, so that the wall of vein is irregular, the lumen of vein is irregular, the wall is thinner in artery, medium-sized artery. We have internal elastic layer. Look at the internal elastic layer, wrinkled layer that separates thin intima from thick media. In the muscular artery, we have circular smooth muscles surrounding the vessel. Look at the venule, also is irregular. We have blood also inside it. That is arterial, shows you arterial. And in capillary, you can observe one endothelium that may be surrounded by pericytes. We have no tunica media and adventitia in capillaries. Also, you here observe one lymphatic vessel with valves in the veins, and the lymphatic vessels we have valves that are protrusions of intima preventing backing flow of blood. Look at the artery at the up and the vein with irregular lumen at the dawn. In the elastic arteries such as aorta, we have many elastic fibers that compose the media, so that in the media we have many elastic artery, and in the muscular artery, we have a smooth muscles at the media. Look at the muscular artery. In the muscular artery, internal elastic layer is obvious and separates intima. I repeat for you, intima from media. Media composed of a smooth muscle, circular layers of smooth muscles. And here also you observe thinner than internal external elastic layer that separates media from intima. And here we have adventitia. I told you that media is the thickest layer in the wall of the arteries, and adventitia is thickest layer in the wall of the veins. Here also you observe one vein with irregular lumen and not distinguishable layers of the wall. And here also you observe the what that I told you. We have valve in the veins preventing backing flow the blood, because the high pressure, because the blood speed in the veins is low, so we have a storing blood in the vein. Goodbye.